Ramil, what are we talking about when we talk about a health system? And what do you see as the components of that system that are typically weakest? What is it that needs to be strengthened when we talk about health system strengthening?
Sure, thank you. I mean, I think the first thing to say is health systems are incredibly complex. So there isn't one thing that's called a health system, and each country will have a completely different health system. So I think the first thing to say is, you know, the systems we're talking about are unique to their own countries. They may have similar features across countries, but to have one health system for any number of countries simply isn't the kind of right approach. So I think we need to bear that in mind. There are, from my point of view, I think 2 or 3 really key elements that we need to focus on, and there will be bits that we can strengthen that are very obvious. So the first, I think, is any health system is really made up of people. So whether that's healthcare providers, community healthcare workers, the Ministry of Health, the government, the NGOs that work on the ground, etc., etc. So I think the first thing we must realise is that healthcare systems are made up of people. So and that's a very complex group of organisations that have to work together. So the first thing is human capacity, knowledge, experience, skill. Do we have the right people in the right places with the right skills doing the right things as an ecosystem? And to have that to really work, you need to have a overarching vision or strategy really owned and embedded by the Ministry of Health, for example. Once you have that, and then a willingness to have a partnership approach, then I think you can start to see that the healthcare system and its components will start to work together. So I think you know, the areas from a pharmaceutical or vaccine company's point of view that we would focus on is the human bit, so the skills, the knowledge. Do people understand what the latest protocols are for treating diseases? Do people have the right understanding themselves as individuals in a country? So do they understand disease themselves? Do they understand how to access healthcare? Do they understand how to get referrals, etc.? Very key component. And then as I say, from a pharmaceutical and vaccine point of view, you know, the system has to be able to sustain quite a complicated supply chain into quite complicated and difficult places. So what I mean by that is, if you have to have a cold chain, for example, so to keep vaccines within a certain temperature range so that when they are given to a child, they are within the required regulatory approved temperatures, you might need a cold chain that stretches all the way through to, you know, very remote places in very warm areas. And to have that cold chain, you need to have a lot of technical expertise. You need to have record keeping. You need to have people with the right skills and knowledge and understanding to deliver all of that. So I think the healthcare system as a whole needs coordination. It needs people, and it needs partnerships between, you know, the NGO world, the government world, and the private sector. In terms of, I think from my perspective, in terms of Africa and developing countries, I think all 3 of those areas can be strengthened. But I think ultimately you go where the place where it has the maximum impact and where the maximum need is right now. And from our perspective, that's really around what we would think of or call community healthcare workers. So really people who deliver fairly basic healthcare information and delivery of healthcare to populations. But what they do is they not only do they deliver healthcare, but they also deliver education. That's a key area, I think, is very key, is this supply chain bit that I talked about just a minute ago, around how do you strengthen the supply chain so that medicines and vaccines are available, not just in the urban areas but to the remote areas, and are controlled from a quality point of view, so that you know that vaccines, for example, have been kept in a cold chain.